My name is Susie Sportsman. I am currently the director of the Academic Consulting Group for Elsevier. I'm being interviewed today because I was in the past president of the Texas Nurses Association, was president for 4 years and have served on the board for a number of years. I also was the past dean of the College of Health Science and Human Services at Midwestern State University for 14 years. But in addition, I served as an administrator of three hospitals, psychiatric hospitals in the Dallas area, and so speak about management and unionization and so forth from both of those perspectives. There's the question of how does unionization affect patient care and the employment environment. And I would say, let me preface this by saying I'm a Texan. I've only practiced in Texas, so my perspective is absolutely that of Texas, the right to work state, and a little more independent focus maybe than some of the other states. However, I have spent a good bit of time in the ANA environment, American Nurses Association, and so I've learned a lot about unionization from that. Historically, the American Nurses Association, many of the states were the collective bargaining agents for many states, and then as time progressed, some of the more the unions who were present in other organizations like the AFL-CIO and the SEIU began to recruit healthcare providers, including nurses. I would say that in an environment, Michigan perhaps, where unionization is a very common thing and many people belong to a union, there is not the fear and trepidation about unionization as there is perhaps in Texas, because we don't have that level of experience. I would suggest that I would prefer to be a manager or an administrator in an environment where there is not unionization, because my colleagues who have been administrators in that environment find that there is such a wall of between the nurses who are practicing and the nurses who are administrators. And as an administrator, I would find that uncomfortable. I have worked as a direct care provider and also worked as an administrator, and I'm a nurse first. And so my decisions, although I'm sure that there are those for whom worked for me who thought that my decisions were only about the administrative, they really were, at least in my opinion, colored by my sense of what was right for nurses and what was right for patients. And so that I would find it very difficult to have that barrier. An example that would tell you a little bit about that barrier, last legislative session, Texas Nurses Association was a proponent of legislation that improved the way that we dealt with staffing in the state. Texas was an early state in developing staffing rules and regulations, and we came back in the last legislative session and revised that to increase the number of direct care providers direct care nurses who were on the committees, and to do things that would really give the nurse the voice. At the same time, the California Nurses Association, or NNOC, had another bill that had some similarities in terms of trying to make sure that staffing was safe and effective for patient care. Their strategy, however, was to go with ratios, and that depending on where you worked, what environment, you had to have X number of ratios. The Texas Nurses Association position about ratios is that often becomes the maximum that you can have, and it takes away the nurse's ability to say, wait a minute, I got 2 sick patients that I must have one-on-one and I need some more patients. The ratios keep it so that there's no wiggle room from the nurses, and my preference would be, and what the Texas Nurses Association thought was it would be better for the nurses to have the ability to flex that depending on the condition of the patients. I was down in Austin testifying on behalf of TNA's bill and heard the testimony of the union's bill as well. And the thing that I was struck with was that their bill required that no manager, so charge nurse, nurse manager, whoever, who was in a management role could not come do an assessment on a patient. That assessment was not the responsibility of anyone except the direct care provider. Well, first of all, I think that's in conflict with the Texas, with the Board of Nursing, the regulations around what our practice is. And secondly, if I was busy, I sure would want the charge nurse to be able to come and help me by doing an assessment. So I think when you get into those artificial rules around what is a manager's role and what is not, it hinders patients' care. Our Texas Nurses Association bill passed, the union bill did not. One of the reasons it passed, I hope, was because it was a better bill, not to say that there probably aren't problems with implementation. But it also, we have a Texas Nurses Association have a really good relationship with the legislators. We have, over the last 20 or more years, really been able to develop relationships and get bills passed. Texas legislators, by and large, are not positive about unions. Now, whether it's right or wrong, I don't know, but that is the fact. And so our ability to move bills forward would certainly be hampered in this state, in this environment, in this legislators, if we were unionized. I do think that the environment in which we find ourselves is a hard one for nurses and for managers who are nurses. It's hard to meet the productivity standards and support the nurses as well. And so being a manager is a hard job, and it's a job that is sort of squished between the middle of the upper administration and the direct caregivers. And so it's a difficult one, but I think, your ability as a manager, as a leader, to listen and to try to provide support for nurses is really important. Now, having said that, I would also say that it's really important for individual nurses, and I would suggest that nurses in general are leaders in whatever role they're in, have an obligation to practice independently and take responsibility for their practice. And sometimes that means being uncomfortable. I have a story that it's about 20 years old, so it may no longer be applicable, but I was the administrator of a psychiatric hospital, and we had an opportunity to start this hospital, and it was a public hospital. We had physicians who were employees, so the whole environment was somewhat different than you might find in a hospital where physicians are independent practitioners. So we really had an opportunity to develop some policies and so forth that allowed people the opportunity to practice to the fullest of their capability. And it's been my experience over my practice that often nurses say that physicians keep them from practicing to the full extent of their practice. In this particular case, though, that wasn't the case, because the administrator was a nurse, that would be me, and the physicians were employees as well. So we had a little bit different arrangement. And I had some nurses come to me 6 months after we had opened the hospital and say, we're just really angry because the social workers are taking over our job. And we think as nurses we should be in charge. And so I said, well, as a nurse, I certainly agree that you need to be able to practice however, whatever is the highest level you can practice. So tell me what it is that you would like to do. I said, I'm not going to take anything away from another discipline, but if there's something specifically that in this process that you think should be a nursing responsibility, we'll see what we can do to make that happen. And they couldn't tell me what that was. All they could tell me was somebody else was taking over. And it taught me that I thought that nurses could be outstanding because I was the administrator and I could, make it happen. And what I realized, of course, is that has to happen with each individual nurse as they move forward, and we have to be individually responsible. So I think if we're not going to have a unionization, then all of us, in whatever role we're in, have the obligation to see our practices as something that we are responsible for and that we have to move forward. I've probably gone off track in terms of the questions that you asked me, but let me say that I once heard a management guru speak, and he wasn't a nurse, he wasn't in healthcare, but he said in Texas, if you have unionization, it's the administration's fault, because we have the environment that we can provide that. So I think it is incumbent upon nurse managers, hard as it is, to listen to their staff and to be advocates for that. And that's not to say that you don't recognize that money needs to be made and we need to handle our resources appropriately and all those things that go into management. That's why being a manager is a difficult task. I do think that nurses join unions partly because their background suggests that it's okay. They had a daddy or a brother or a sister or whatever that was in a union, and I think that changes the way people believe about it. And then secondly, they belong because they feel they're not being heard. Now, some of that is their responsibility, but much more of it, I think, is the administration and the manager's responsibility. It's a hard time to be a nurse, but it's a really good time to be a nurse. I think there's a lot of opportunities for nurse leaders, and so I congratulate all of you who are learning to be nurse leaders. I hope you'll continue to manage nursing so it's a place where we all want to work.